It's good to be with you again today. I'm your host, Akin Ayeni, born-again Christian, family physician, addiction disease specialist, a servant of the Most High God. We're going to go over some of the topics that we've done before because we have a new audience, and we believe that some of these topics have not been shown to a new audience before. So we're going to be doing a few topics on addiction in the next several broadcasts. First, we're going to talk about the cardinal signs of addiction. Cardinal signs of addiction. There are 4 cardinal signs of addiction. There are more than 4 actually, but there are 4 signs that we always want people to look out for in order to come to the conclusion that someone has an addiction problem. The reason why it is important to know these cardinal signs is because a lot of addicts in many families deny the issue of addiction. And family members see some behavioral changes in this person, but they can't put their finger on why this is happening. They don't know, they really don't have education about the behavior of addicts. And because they don't have the education about the behavior of addicts, they cannot pinpoint certain behavioral traits in the addict that are abnormal and really are the signs that the person is beginning to get into drug use. The first sign I'm going to talk about is obsession. Obsession. Now, an addict is very obsessed about his drug of choice. It doesn't matter what the drug of choice is. It could be heroin, it could be cocaine, it could be pain pills, it could be any other substance. In fact, even for those who are addicted to activities, the things that we call non-chemical addiction, they also have obsession about the activity of choice. For example, a relationship addict is obsessed about relationships. A gambler is obsessed about gambling. A sexual addict is obsessed about sex. Someone who is addicted to pornography is obsessed about imageries. They have illusions. They have what we call addiction to illusion of relationship. Well, we're not going to go into details about that, but we just want you to know that a major sign of addiction is obsession. And what kind of obsession are we talking about? And an addict is preoccupied with the drug of choice. So to be obsessed is to be preoccupied with that drug of choice. And what does that really mean? That means they think about the drug of choice round the clock, 24 hours of the day, 7 days a week. That is their preoccupation. It doesn't mean that they are using 24 hours of the day, 7 days a week, but they are always thinking about it. It's the preeminent thought in their mind most of the time or all the time. So they are obsessed about the drug of choice. They think that drug is very vital to their survival. See, for an addict, nothing in this world is more important than their drug of choice. They're so obsessed about it that they will leave everything else undone to be able to get to their drug of choice. I've seen addicts, if they have to, if a woman who's addicted to heroin or cocaine or any other drug has to meet with her supplier at a particular time of the day, let's say they have a rendezvous place at 4 p.m. in the afternoon. And if she was supposed to pick up our daughter around the same time, maybe from the babysitter, guess who is going to have to wait? The daughter. The daughter will have to wait, and this lady will make sure that she gets a supply. That, my friend, is a sign of addiction. Number two, the second sign that I'm going to talk about is continued use of the drug despite negative consequences. If an addict continues to participate in an activity or use their drug of choice, whether it's heroin or alcohol, in spite of the fact that they are having negative consequences due to the use, then that's a sign of addiction. And let me give you some examples. I've had patients who are addicted to alcohol. When I show them their results, like, alcohol affects the liver. If I show a patient his liver enzymes, which shows that his liver is beginning to get damaged, the liver enzymes are going up, and if I try to threaten them that, look, you need to stop drinking, look at your liver enzymes. If you don't stop, you're going to end up with hepatitis. If you don't stop, the hepatitis will lead to cirrhosis, and cirrhosis kills. They will hear me very well, and they will promise that that particular person, and it happens to a lot of my patients, they will hear very well, they will promise to stop, but as soon as they leave the treatment program, they're going straight to the liquor store. They continue drinking despite negative consequences. And it could be any other type of adverse consequence. It could be legal consequence. Someone who has had two DUIs, and they warned him that if you continue to drink, we're going to get your license. And let's say this person, he needs his license for his daily living. Maybe he's a truck driver. And he knows that if he loses that license, he's not going to be able to drive a truck. He will still continue in spite of those negative consequence, losing his license. And until he loses that license, he can't get himself to stop. That is a sign that he's addicted to it. How about marital consequences? You have an addict who is about to lose his spouse. The spouse is threatening to walk away from the marriage if he doesn't stop using, and yet he can't find a way to stop. That is a sign of addiction. It could be financial consequences. They use all their money to support their habit, and they still can't stop. So if an addict continues to use in spite of negative consequences, that is a sign of addiction. The third sign is lack of control over use. Lack of control. And that means they cannot stop when they start. An alcoholic has 2 6-packs of beer at home, and he can't stop until he finishes these 2 6-packs. A cocaine addict has a stash of cocaine at home, and he cannot stop until he finishes. A gambler goes to the casino, and until he runs out of money, he can't stop waging bets. That is a sign of addiction. So If someone cannot control, cannot gauge their use, it's a sign that they are addicted. And the fourth sign is denial that the problem exists. Denial. If you catch an addict, like a pickpocket in the very act, maybe you see them using something, they will deny that it's a problem. That is a sign of addiction. Denial that the problem exists is a sign of addiction. It could be, and denial comes in different forms. It could be absolute denial. An addict will tell you that I don't have a problem, I don't know what you're talking about. So it could be absolute denial. They will totally deny that they have this problem. Number two, it could be minimizing. They can minimize the problem. They will say, well, because you and this is usually when you have really, when the addict knows that they can't deny anymore because you caught them actually red-handed, then they say, well, I don't use that often. I don't use like John Doe down the road. That is another type of denial. Or they can blame other people. They may say, well, I'm using because my husband is abusive. That's why I drink. Or I'm using because my wife is always nagging. I'm drinking because my wife is always nagging. That is a sign of addiction when they begin to blame others. Or it could be rationalizing. They rationalize the use. They may say, well, like I said, oh yeah, I'm using because I have a son who is always getting in trouble. Or I have a father who is always abusing me. They are always trying to rationalize the use, or there might be a different type of rationalization in which they may say, well, they can intellectualize it. What does that mean? They can say, well, I'm used because the reason why I use cocaine is because it makes me lose some weight. Or I was told that alcohol is good for cholesterol, that when you drink a little bit, it can lower your cholesterol. So they are rationalizing it or intellectualizing it. So those four signs are very important. If you see any of these four signs that I just mentioned, my friend, the person that is exhibiting these signs has addiction problem. Let me go over them. Let me summarize again and go over the four cardinal signs. Number one is obsession over the drug of choice. That means they are preoccupied with it. They think about it all the time. That's a sign of addiction. Number two, continued use despite negative consequences. No matter what is falling apart in their lives, it could be financial consequences, it could be legal consequences. They may have had 2 or 3 DUIs. They might have been caught selling drugs and they've gone to prison for it, and they come back out, they still continue to use. Legal consequence. It could be medical consequence. Like I mentioned before, someone who, because they are drinking, they now have liver cirrhosis, they can't stop drinking. Or someone who is shooting drugs, they now have hepatitis, they can't stop shooting drugs. Or they have HIV, they still can't stop shooting. They have medical consequences, they can't stop. And so that's a legal consequence, and yet they can't stop. It could be marital consequence. Like I mentioned earlier, when a wife is threatening to leave, they have marital estrangement, and they can't stop using the drug of choice. So continued use in spite of negative consequences. Number three, loss of control over the use. That means they cannot gauge it. They can't stop when they start. They have 2 6-packs at home. They continue drinking until they pass out. They have a stash of cocaine at home. They continue using until it runs out. Loss of control over use. And the final one is denial. Denial that the problem exists. No matter what is going on, it could be absolute denial in which they say, I don't have a problem, I don't know what you're talking about. Or they minimize it. They say, I don't use that much, I don't use like the other guy down the road. Or they avoid the subject altogether, or they blame others for the problem. So if you see those 4 cardinal signs, just be rest assured that this person has drug problems. And we'll be right back. We've been talking about addiction, and we gave 4 cardinal signs of addiction. We talked about obsession, that is, the person is obsessed with the drug of choice. We talked about the continued use despite negative consequences. They can't stop using the drug of choice in spite of negative consequences in their lives. We talked about loss of control over use. They cannot control the use, they can't gauge it. We talked about denial, that is, denial that the problem exists. And the question I want to ask you is, why will anyone be totally obsessed with drugs, something that is really from the stalk of the tree? Cocaine is from coca leaf, heroin is from poppy leaf, alcohol is from grapes. So why will anyone be preoccupied with things that actually naturally grow on the tree? The fact is, there's more to addiction than just physical addiction. The addict really, in essence, when is totally addicted to the drug of choice, is devoted. That's all he thinks about. The word addiction itself is from the Latin word addere, which means devotion. Something that I'm addicted to or devoted to, or something I worship. It's my object of worship. If you look very well in 1 Corinthians chapter 16, verse 15, they were describing the house of Stephanas. They said they were addicted to taking care of the saints. Another translation says they are devoted to taking care of the saints. So the word addiction means devotion. It means something the addict worship. If you ask an average addict, how much do you think of your drug of choice? They will tell you, that's all I think about, 24/7. That's my preoccupation. That's my object of desire. That's what makes my eyes, that's what gives me starry eyes. That's what I long for. They yearn for it. That is their God. In essence, that is their God. Let me say that again. That is their God. That's their idol. That's what they idolize. But you see, this is not the first time that man can be totally captivated by a false God. The enemy doesn't change. The enemy may camouflage his methods, but it's always the same enemy. He wants to take the glory of a man that man is supposed to use to glorify or to give to his creator. The enemy wants to hide behind the sin and take all that glory to himself. That's in essence what's going on. He wants to be worshipped. Satan wants to be worshipped. And so he puts a camouflage. He uses a camouflage. He dangles something in front of people so that they feel that they are enjoying themselves, not knowing that's a trick to captivate them, to lure them away from God. Let me give you a good illustration. In in Isaiah, in the book of Isaiah, chapter 44, they were describing a man, you can read it for yourself later on. They were describing a man who goes into the forest to cut down a tree. He went to the forest himself to cut down this tree. He brought the tree home. He used part of this tree to warm his food. He used part of this tree to bake his bread. He used part of this tree to warm his room. Then he now took the rest. He makes it into a god. And every morning he goes down to bow down in front of that graven image that he himself fashioned to look like a man, and then he calls it his God. Same thing the cocaine addict is doing. with his drug of choice. When you give your money to the drug man on a daily basis, when you give your money to the drug man to buy cocaine or to buy heroin that will not profit you for anything, guess what? That's your God. That's what you worship. If you take all the money that you make for the week to give to the drug man, that's your object of worship. You've totally relinquished yourself to that drug man. The drug man really is your God, or the cocaine itself is your God, because it doesn't matter who gives you the supply. That tree, that stalk of a tree has become your God. It's what you worship. It's your false God. But God says in the book of Exodus chapter 20, he says, thou shalt not have any strange God before me or besides me. No strange God. He says, man must not have any other God beside him. So when you totally relinquish everything you have to cocaine, that's your God. That's what you worship. That's your object of desire. That's what captivates you 24 hours of the day, 7 days a week. Look at what is said in 1 Corinthians chapter 10, verse 19. It said, do I mean that a sacrifice offered to an idol is anything, or that an idol is anything? No, but the sacrifices of pagan are offered to demons, not to God. And I do not want you to be participants with demons. So what does this mean? It means that anytime you use every part of your God-given resources to buy cocaine, to buy heroin, you are in fact giving your God-given creativity to false God. That's what it means. That's what they are describing in Isaiah chapter 44, verse 19. Read it when you have time. This guy went to cut down a tree, similar to someone going to buy cocaine, which is from coca leaf. And when you totally are captivated by that cocaine, it means it's your God. You are presenting yourself, your members, to this false God. God says, present yourself to me to worship. I said in Romans chapter 12, he said, I beseech you therefore, present yourself a living sacrifice, holy and acceptable to me, not to false God, not to cocaine, not to heroin. So when you take everything you earn for the week or for the month and you give it to the drug man, guess what? You are presenting yourself to a false God. When you present your nose to snort cocaine, you are presenting your God-given member, your God-given organs to false God. When you drink alcohol, you are presenting your God-given throat to false God. It's the same thing. You can't see these demons, but they exist. They exist. They are persona. There was a time I had a patient who was smoking crack and was hearing voices. And she came to my office. She said she's been smoking crack and hearing voices. I said, what are these voices saying? She said, they're asking her to kill herself. My friend, there's nothing like a voice without a person. So if that lady did not want to kill herself, whatever voice is talking to her has a person behind it. It's a persona, it's a spirit, it's a demon. They talk, and they talk to people. They want to take what belongs to God, that God has given you. They want to kill, steal, or destroy. So my friend, If you are in this category of taking all your God-given faculties and giving to idols, you need deliverance. You need to be delivered from this. You need to be prayed for. You need that thing to be cast out of you. In one of the episodes that we're going to be doing, perhaps in the next several weeks, we will repeat what we discussed with Apostle Aladekoba on the issue of deliverance. You may need that, and you may need the prayers that go with that to be delivered from this false god. You need deliverance, because there's nothing that could captivate a person totally, take their God-given glory, take their money, take their life, take everything they have. Even they lose their husband, they lose their, if there is a woman, she loses her husband, it's a man, she loses his wife, they lose all their money, they lose their job, and you think that just happens? My friend, you are being driven by a demon. An evil spirit is taking everything that belongs to you, and you need to be delivered from it. You need that thing cast out of you. You need deliverance. You need to be prayed for. So I want you to watch a few of the episodes that we did with Apostle Aladekoba and some of the prayers that we prayed for people there. You need it, and you need to be delivered totally and be set free from these false idols that is taking away all that God has given you. The Bible says, all have sinned and fallen short of the glory of God. The essence of sin is not just that we committed some heinous act. The essence of sin is that we are given our God-given glory and creativity to a false god. And if you are in that category, you need deliverance. You need that thing to be cast out of you, so that you can now begin to give your God-given creativity to the true and living God. That's what you need. And that's going to have to do it for us today. I'm your host, Akin Ayeni, born-again Christian, family physician, addiction disease specialist, a servant of the Most High God. Until next time, we thank you for viewing this.